Hi guys, and welcome back to our channel. Today we are going to be talking about diagnosis versus procedure. And if you are taking the Certified Billing and Coding Specialist class or the CBCS class, that is something that we really hone in on in this class. And this video specifically for our CBCS students. But if you are taking another KLR course, just remember that this can be helpful to know in any healthcare field. And so feel free to continue watching, and hopefully this will help clear up any confusion that you might have, especially for billing and coding students who have some assignments over this specific topic. So I think the first thing for us to do is to understand the definition in a diagnosis versus a procedure. So I want to first mention that a diagnosis can also be called a condition, and it could be called an illness. So a diagnosis represents a medical condition or illness or disease that a patient is suffering from. And it's a statement of what is wrong with the patient and why they sought medical attention. A procedure, which could also be called a treatment, the procedure refers to a specific medical service or treatment that is performed to address a medical issue or diagnose a condition. Procedures are actions taken by healthcare providers to treat, diagnose, or monitor a patient's condition. And so the two are very different, and it's important to understand these differences. We can check the terminology to determine the difference in a lot of these. So we can look for medical terminology that typically indicates a diagnosis, such as terms related to diseases, disorders, symptoms, or conditions. Like looking at common prefixes and suffixes, such as itis, which means inflammation, or osis, which means abnormal condition. These often suggest that this is a diagnosis. And if you know that, that's going to help you determine the difference between the two. Procedures are typically indicated by terms related to actions, interventions, treatments, or tests. Terms like excision, repair, biopsy, and aspiration usually denote procedures. And so we're going to talk a little bit more about those. But for you CBCS students, it is really important for you to know this, because when you go to take your national exam, you are going to be asked questions such as, which of the following is a procedure that, and then it will give all kinds of ridiculous information about a procedure you might not actually know anything about. There are tons of them. We talk about some of them in class, but you might not know anything about. So the list is going to give you 4 options. Your whole test is multiple choice. It's going to give you 4 options. And those 4 options, only one of them is going to be a procedure, guys. The others are diagnosis. And so if you know the difference between a diagnosis and a procedure, you're going to automatically know the answer to this question. And that is why we practice this skill in class so much. So let's look at some of these. So an appendectomy. So we're gonna ask ourselves, is an appendectomy something that is wrong with me or something that is done to me? Something that is wrong with me would be a diagnosis. Something that is done to me would be a procedure or a treatment. Okay. Which one do you think it is? I want you to look at the word ectomy at the end as well. That's going to be a surefire sign right there. You're going to really hone in on those prefix and suffix clues. So an appendectomy, guys, is going to be a procedure or a treatment. It is something that is done to you, not something that is wrong with you. Okay. Our next one is hypertension. Hypertension, if you do not know, has an abbreviation of HTN. We talk about that in pharmacy class and billing and coding class. You need to know that. And it is the same thing as high blood pressure, which is HBP. So hypertension, is that something that is wrong with you? Or is that something that is done to you? Can you go to the doctor and get hypertension? The answer is that hypertension is a diagnosis or condition, illness. That's going to be what this is. It is not a procedure. Let's look at this word. Excuse me, guys. Cholecystomy. It is going to, you are going to look at the end of the word ectomy. That is very, very important. Ectomy at the very end. And if you look at the one that we were just looking at, ectomy, we looked at appendectomy. Ectomy is here as well. Ectomy is that suffix that you are going to be looking at, and that is going to tell you immediately, hey, I know the answer to this. I know whether or not this is a diagnosis or a procedure. And remember, again, a diagnosis is something that is wrong with you, and a procedure is something that is done to you. This is a procedure or a treatment. Diabetes mellitus, or DM. Is diabetes mellitus a procedure, or is it a diagnosis? If you chose diagnosis, you are correct, because a diagnosis is something that is wrong with you. It is a condition. It is an illness. The next one is endoscopy. Again, we are going to be looking at those suffix clues. And so scopy right here is going to tell us, it's going to be a big surefire sign. We need to look at the ending, and we should know the answer to this. Is this a diagnosis, which is something that is wrong with you? Or is this a procedure or treatment, which is something that is done to you? And if you chose that this is a procedure or a treatment, you are correct. The next one is osteoporosis. Is osteoporosis a diagnosis, or is it a procedure or treatment? If you remember on the first couple of slides when we were talking about the clues that we should be looking at and determining the differences and the medical terminology between the two, we looked at the word itis, which was a big one. And this is similar to that, osis. This is a diagnosis. Osteoporosis is something that is wrong with you. It's a condition. It's an illness. It is not a procedure or treatment. It is not something that is done to you. Arthroscopy. Now, you might not know what an arthroscopy is. You may not be able to explain arthroscopy to a patient, but you should be able to look at your ending suffix clues, scopy, and you should be able to tell somebody that this is a procedure or a treatment versus a diagnosis or a condition. An arthroscopy is something that is done to you. Pneumonia, we've all heard of pneumonia. Is pneumonia something that is wrong with you, or is it something that is done to you? Pneumonia is a diagnosis. Colonoscopy. What should you be looking for in these words? You should be looking at your suffix clues. Scopy is a big clue for you to know that this is a procedure or treatment. Migraine. You've all heard of migraines. Is a migraine something that's wrong with you or something that's done to you? That's what you should be asking yourself each time. Migraine is a diagnosis or condition. Angioplasty. Plasty. That's the word you should be looking at. Your suffix clues there again, plasty. This plasty is going to tell us that this is a procedure or a treatment. It is something that is done to you. Rheumatoid arthritis. We've all heard of it. And if you look at arthritis, there is one of the terminology hints that we were given at the beginning of this presentation, which is itis. It means inflammation of. This is something that is wrong with you. It is a diagnosis or a condition. Cataract extraction. Cataract extraction. I believe extraction was on our list of clues. Extraction is a treatment or a procedure, guys. That's going to be your clue right there. Cataract extraction is a procedure or a treatment. Asthma. Again, we've all heard of asthma. Is asthma something that's wrong with you or something that's done to you? And if you said that asthma is a diagnosis or a condition, you are correct. Cardiac catheterization. Is this something that is wrong with you? Or is it something that is done to you? This isn't one that is going to be like, oh my gosh, I know off the top of my head from my suffix clues. But if you just think about it, is this something that is wrong with you or something that is done to you? This is a procedure or a treatment. Hysterectomy. And there is our favorite word again, ectomy. Is a hysterectomy a diagnosis or a procedure? And if you said that it is a procedure or a treatment, you are correct. Heart failure. Which one do you think this is? Heart failure is something that is wrong with you. It is a condition or an illness. This is a diagnosis. Vasectomy. Even if you can't explain what a vasectomy is, you should be able to look at ectomy and you should know by your suffix clues there, ectomy, that this is a procedure or treatment. And ovarian cancer is our last one, guys. Is ovarian cancer a diagnosis or is it a procedure? Like any cancer, ovarian cancer is a diagnosis. It is a condition. It is an illness, something that is wrong with you, not something that is done to you. I hope this was helpful for all of you, especially those in the CBCS class. Comment and let us know what other videos you would like to see us make that can help with things that you are specifically doing in your classes at KLR. And be sure to subscribe and like this video if you want to see more content like this. And we will see you guys back next time.